Good evening, dear viewers, and welcome to Medical Talk. Although irritable bowel syndrome is a long-term condition, many patients are able to manage their symptoms successfully and maintain a normal, active lifestyle. Advances in medical care, together with simple lifestyle adjustments, have helped many people improve their quality of life and reduce the impact of symptoms on their daily routines. But what treatment options are available today, and what practical steps can patients take to feel better? To answer these questions, we are pleased to welcome Dr. Khaled Altamimi, consultant in internal medicine, gastroenterology, and therapeutic endoscopy. Welcome back, Dr. Khaled, and thank you so much for giving us your time and being with us today.
Thank you. It's my pleasure. And let us tell our viewers about how to live with this condition. You know, I always like to tell to my patients that even though irritable bowel syndrome is a chronic condition, that's something that they will have to live with for the majority of their life.
Exactly.
It is not a serious condition, though. It is not something that leads to any cancer. It doesn't lead to any more serious conditions, inflammation of the bowel. So really part of
it's adjustable, which
Yeah.
is why I'm going to ask you, many people, they have to live with it. So what other treatment options they can seriously take to continue living life as normal people?
Yeah, so we always start with the non-pharmacological therapies. So it is because we know already, and we have spoken about what causes it, and the gut-brain axis, and that it is really strongly associated with stress and psychological conditions. So once we manage that, and we really put that as our priority, you will see a lot of patients will dramatically improve before even getting to the medications. So we always try to say, I divide it into managing stress, dietary habits, and then medications. So we manage stress by exercise is the first thing, mindfulness, having good quality sleep, and being mindful and reducing the things that cause stress, whether it's due to habits or due to certain ways of thinking. So that's first and foremost. Then we go into the diet and dietary habits, which we try to notice which are the food triggers. So there is ways of eating, so eating regular small divided meals rather than one large meal in a day, and knowing what type of food can trigger the symptoms. And this is essential. These patients do have a hypersensitive gut, so trying to deal with that and trying to manage the stress and reduce the things that cause gas in the gut will definitely help to resolve the symptoms. And in certain population of patients that do not optimally respond to these modalities, then we go into the pharmacological therapies. So the pharmacological therapies are also tailored to the patient's symptoms. So as we said, most patients will have the abdominal pain. So for those patients, we prescribe them antispasmodic medications, things like Buscopan, things that reduce the intensity of the cramps. Peppermint capsules can help also reduce the gases and the spasms. And then depending on whether it is diarrhea, so we can give them anti-diarrheal medications, or whether it's constipation. There are some supplements or some dietary fibers like psyllium husk are very effective actually in increasing the stool consistency, and it's useful for both patients that have diarrhea and have constipation. This can be effective. Optimizing the dietary fibers, the soluble dietary fibers per se, so things like oats, psyllium husk, certain types of fruits, and avoiding the insoluble fibers that are not easily digestible. So that's with regard to the diet. There are I would say a minor subset of patients that doing all that may still require medication that will modulate their response to pain. So as we know, the gut has so many nerves, and these nerves are linked to the brain. And some of these patients have coexisting psychological conditions like anxiety and depression. So these patients, we notice that they will benefit from medications that are used for anxiety and depression, things like antidepressants and SSRIs at smaller doses will be very effective in managing gut symptoms.
So it's like a domino effect. If one part of the body is affected, it will make the symptoms worse. Like you said,
yeah.
it's the psychological aspect, the dietary options,
Yeah.
and finally the medication they have to take. So, Dr. Khaled, many people with IBS are looking for some simple advice they can apply in their daily life. Do you have any advice for those people?
Yeah, so I like the way you put it, because it is a mind and body. It's not that they are separate entities. So mind and body is one. So we have to work on both. If we work on our bodies, our mind will be healthier, and vice versa. So what I always say to my patients is that I try to reassure them that this is a benign condition. It will not really lead to more serious problems. And I will tell them that because most of these patients are younger, I will tell them that these habits that you will do to help you with IBS will also help you with your overall health, especially further down the line when they get older, if they eat healthy, if they
So maybe IBS could help
maintain.
them maybe improve their lives.
Absolutely, so if they control their weight, if they eat healthy, if they exercise, this will have a very positive impact. They don't smoke. They will have very positive impact on their health. It will prevent chronic diseases in the future, things like diabetes, high blood pressure, strokes, and cancers.
They can maybe get rid of the chances of getting any of these chronic diseases. But as we know, IBS is also a chronic disease. Maybe if, like we said, people who actually follow the things you say, maybe
Yeah.
they can minimize IBS to the fullest. Maybe.
Totally. We can reduce the frequency of the symptoms. What these patients have is that they have it is relapsing and remitting. So they have periods where they are perfectly normal, and during stressful times they may experience those symptoms. So the more that they change their lifestyle, the more that they maintain a healthy lifestyle throughout their life and do that day to day, then it is going to have a positive impact on their irritable bowel syndrome, but also on their health overall.
Thank you so much, Doctor, for being with us today. And thank you, dear viewers, for watching another episode of Medical Talk. So wait for another interview on another episode on Medical Talk next time.